My disclosures can be found in this QR code. So today we know that the PAO is a treatment of choice in patients with hip dysplasia, and we have shown excellent outcomes at long term. These patients are able to go back to normal life and being really active. However, when we talk about the borderline hip, it's actually a lot of controversy. Some proponents of doing the PAO in these patients, and then some others that said with hip arthroscopy, you should be okay. So as we have seen this morning, decision-making is actually a clinical dilemma. So what happens when you treat according to the literature? What happens when you treat with hip arthroscopy a borderline dysplastic hip? It has been shown to be successful at short-term follow-up. However, 40% of these patients may still experience a suboptimal early outcome. And most studies report high variable degrees of success when doing hip arthroscopy plus capsule application. So this is a study systematic review where they reported the amount of failures that you see if you treat with hip arthroscopy a borderline dysplastic hip. And the problem here is that it's very variable. So you will have studies that they basically do not report any failure, and then you will have studies that they go up to almost 50%. So when you start reading these papers, the problem is that they're only reporting on the LCE. So we are not really comparing the same type of population or patients, although we are all calling them borderline dysplastic hips. So if you look into the literature, what is the most common procedure that patients get after a failed hip arthroscopy in the borderline dysplastic hip is going to be another hip arthroscopy.